In 2024, eHealth Africa's Insights webinar series ignited powerful conversations on transforming public health. Let's take a quick journey through the key highlights that are shaping the future of healthcare. The first edition of Insights webinar focused on strengthening laboratory services and building robust lab infrastructures that are key to diagnosing and treating diseases in the most remote regions.
What we do in laboratories is to do experiments that we call tests. And a test is a simple, standardized and reproducible experiment. When you standardize an experiment, it is reproducible, you deploy it as a test. And therefore, at all times when you are doing a test, you are looking for something unknown.
Then, we powered up the next conversation with the need for integration of renewable energy solutions into health systems. The edition explored how solar solutions are lighting up health centers in remote regions and ensuring reliable care when it's needed most.
You have to consider that once you bring in renewable energy, you are very certain that services are going to improve.
In March, we commemorated the International Women's Day by spotlighting the importance of investing in women to accelerate digital progress. At eHealth Africa, we are definitely empowering women to lead in technology and public health innovations.
There's no gender-based type of roles in the home front.
Insights webinar for the month of April focused on the World Health Day theme, My Health, My Right. In this edition, we discussed the importance of equitable access to care for all, especially those in underserved communities. As you already know, reaching underserved communities remain at the center of eHealth Africa's mission as an organization.
Everyone will take personal responsibility of their health. That is why it is used my health, personalizing it, and my right. If you ask people about a right, people know a lot about human rights, but most often we neglect the aspect of health as a component of that human right. And indeed, it is upon that every other aspect of life and productivity is based.
For the 5th edition of Insights webinar in 2024, we showcased how blood information management systems are saving life by improving the accuracy and efficiency of blood transfusion processes. The spotlight was on the ongoing collaboration between eHealth Africa and Aminu Kano Teaching Hospital as we are set to deploy our in-house blood information system for crisis intervention and management, BISCIT, for improved blood management to save lives.
So a blood information management system is a software, a specialized software solution that consists of both mobile and web applications that are designed to manage various aspects of blood donation chain. This starts from the initial blood donation from donors to storage, to testing and distribution of the blood products to health facilities and other blood banks. So overall, a blood information management system plays a crucial role in ensuring the safety, availability, and efficient utilization of blood products for transfusion. And this ultimately contributes to improved patient outcomes and healthcare delivery.
As the threats of climate change grow, the discussion for the month of June focused on how its impact on public health demands innovative solutions to mitigate risks and protect vulnerable population.
Research has shown that the burning of fossil fuels accounts for over 75% of greenhouse gases emissions globally. And some of these gases include carbon dioxide, methane, nitrous oxide, and fluorinated gases. There are other contributors to climate change, and some of these include deforestation, agricultural practices, looking at increase in livestock farming, use of fertilizers that contain nitrogen, overfishing. There's also a component around industrialization and urbanization that all are directly or indirectly as well linked to increased emission of these greenhouse gases. And then when you look at some of the impacts of climate change, so the impact of climate change, the causes are multifaceted, the impact is also quite multifaceted. I already talked about the temperature rising or the temperature rise due to climate change. We also have impacts around extreme weather events.
In July, we hosted the Insights Learning Forum, where industry experts gathered to chat pathways to improve digital transformation in public health practice. The discussions on digital transformation in public health practice continued in the next episode of our webinar held in August.
We should take away from COVID, another thing that we can use to sustain the momentum is, we've talked a lot. I think almost every digital health conference I was at this year talked about interoperability and the need for us to be able to share data. I remember during the pandemic, we ran a level 2 isolation center, which meant that when patients deteriorated, we needed to send them to tertiary centers. And that was difficult, because all of this needed to happen through paper, people needed to get information. Sometimes these transfers needed to happen in the middle of the night. One of the things that eventually happened as the pandemic developed was we developed a system, a case management system, where we would put in information for the patient, and this would be readily available to the referral facility. I think that was a great development, and we should not stop. We should just look for how to extend the use of our digital health tools, because patient care is collaborative, even within one facility, right? I need the input of the pharmacist to tell me, what medications this patient is going to respond to. I need the input of the lab. So which means that even if I want to manage a patient in primary care, if I need to refer this patient to secondary care, the doctor needs to have all the information they need to provide this patient adequate and safe care.
September was an opportunity to discuss our efforts in tackling non-communicable diseases like hypertension and diabetes. Panelists discussed how eHealth Africa is domesticating the package of non-communicable diseases (NPEN) in Nigeria to empower communities to prevent and manage hypertension and diabetes and live a better life.
Talking about how we can demystify, or that wrong belief that NCDs are for the elderly. So first is for us to know that the causes of this, be it hypertension, be it diabetes, you will have some what we call modifiable risk factors. So that is why we should not, base it on just for elderly. So even the young people are exposed to it, and then of course we have a lot of young people come down with hypertension and even diabetes. So that is why on this course, I'm sure we're going to have some time to speak, to the NCDs, how people get exposed, or what are those risk factors. We have the modifiable risk factors and as well as the non-modifiable risk factors. The people's lifestyle. You can see a young person who is an alcoholic. You can see a young person who is obese. So these are risk factors that exposes the young. So it is not just for the elderly. Everybody is involved.
In October, we marked the World Polio Day by contributing to conversations on the need to unite for the final push to end polio. We also highlighted the important efforts of state and non-state actors in the drive to end the circulating variant of polio virus.
How does it work? Polio virus causes paralysis. Out of 200 people infected under normal circumstances, one will develop paralysis, or sometimes it can weaken the muscles that are involved in breathing, making the child to suffocate and eventually dies. That is the danger of the polio virus. Only way out is prevention, and that prevention by taking the correct vaccine and the correct doses of the vaccine.
Finally, GIS technology is connecting communities like never before, mapping out healthcare access and ensuring that no community is left behind in public health planning.
Go to Borno UC, see those maps printed in the wall of the UC there, and you see the improvement, how it has changed from red to green. So that almost the whole of Borno is almost green right now. So that is one of the things, and it helped them to drive attention to places that are red, so that interventions like community informants can be community informants are like locals that can access some places that even militaries could not access. So you need to drive the attention to those locations. Also, another use case for those digital maps is a GIS microplanning. GIS microplanning is like a bottom-up approach to ensure that every location is planned for and every child is reached.
From digital innovation to climate action, the Insights webinar series has shown the immense potential of collaboration and technology in transforming healthcare for the better. Thank you for joining us. Together, we are shaping the future of healthcare.